Now, it's a breakthrough, giving hope to millions of us. Oxford University has revealed a coronavirus vaccine could be available by Christmas. Now, it's not yet known if the vaccine can stop people getting or spreading coronavirus, but in a trial of more than 1,000 volunteers, everyone given the jab had a strong immune response. Health Secretary Matt Hancock has previously suggested frontline health and social care workers will get the vaccine first. But who should be next in line? And will you be trying to jump the queue, Janet?
I think anyone over 70 doesn't need to feel that they are jumping the queue, because I think it's their human right to get the vaccine next, because they are more likely to get the disease in the first place. And if they get it, they're going to have more trouble shaking it off. I mean, I'm really, really lucky and I haven't had the virus. So I think it goes without saying that pensioners, but maybe if they want to put the pensioners in order, that people over 80 are even more likely to suffer the ill effects of COVID than people between 70 and 80. So you could stagger it according to age groups. But as the government already give out vaccines for flu, and then now you can get vaccine for shingles too, it makes sense that this should happen. But after that, I would like to see the unemployed get the vaccine next, because over the next few weeks, factories and businesses all over this country are going to lay off thousands of people. As it is every day, we hear of people being laid off, and they're the people that are going to have to go out to job centres, to they're going to have to leave their homes and work really hard to get further employment. So I think we owe it to them to make them healthy and protect them from the virus. And also they're going to suffer financially if they can't work.
Yeah, absolutely. I think that people shielding should definitely get the vaccine. I mean, shops are saying they're not going to enforce people wearing it, and neither are the police going to get involved in terms of enforcing people wearing masks, which I think is putting the responsibility back on us, isn't it? Which is difficult. But I think that for us, people that are shielding, people like myself who've got lupus or have got long-term health conditions, should be right up there and hopefully being seen as a priority to get the vaccine. Because if we don't get the vaccine and we get the virus, I think we're going to cost the NHS far more in terms of treatment than if we just vaccinated us from day one, maybe.
What's interesting is obviously there's a load of information and statistics that's come out today. And what some are saying is that obesity doubles the risk for those going to hospital due to severe symptoms, while patients from Black African backgrounds in England and Wales are dying at more than triple the rate of white people, and that they should be offered the vaccine first. Also, healthcare workers as well absolutely should be they're front line, so they should be first in the queue.
I mean, I think it's so exciting in one way that they've really, because normally a vaccine takes 5 to 10 years, so it's quite exciting in one way that they've worked so hard that this could be available by Christmas, but also for me slightly worrying because it will be a kind of new vaccine. So I have to say, girls, I'm happy to be at the back of the queue for it.
You still feel a little bit nervous?
Yeah,
I'm scared.
No,
that is such a short-sighted attitude. This vaccine, by the time it goes on sale, will have been tested on literally thousands and thousands of people. And one of the reasons more of these vaccines, because there are 3 or 4 competing in this country alone, and one of the reasons they're not testing more, doing more trials in this country, is our infection rate is not high enough. So they need to test it in areas where COVID is really on the rise.
Yeah, and I think that's good, and I'm happy for you to test it.
But I think this whole anti-vaccine argument, don't get me started.
Yeah.
Vaccines are vital.
Yeah, I
agree.
I'm just scared about the side effects.
Well, do you know, obviously this has all just happened right now, so I'm sure this is a discussion we're going to be coming back to time and time again. But, Kelly, I want to come back to something that you touched on there earlier, which was about masks. Because Devon and Cornwall police have said that their officers will not respond to calls over those who flout the face mask rules, saying that they just won't have the time and they'll only get involved if there's a public order offence. Now, retailers have also said that their staff can't be expected to make shoppers wear masks. So on Friday, when the face masks become mandatory, do you think, Kelly, do you think that it is down to the general public to stand up against so-called face mask flouts? Would you tell someone to put on a mask?
I'm not sure that I would. I mean, I've been made to feel really uncomfortable in the past just for wearing one. So I don't think that I would definitely like go up to somebody and say you should be wearing a mask or be condemning somebody for not wearing one. Equally, though, if I was in a public place where I felt like it was, it was a very enclosed environment and it was very an intimate space, and I felt like that person was in my face, I might then say, excuse me, you're not wearing a mask. Could you move away or could you social distance a little more? That's the kind of way I think I would handle it. I think kind of calling people out can sometimes lead to aggression and all kinds of things. And I don't want to put myself in that kind of danger.
Yeah, no, I agree with Kelly in that. I don't know if I'd be brave enough to actually go up and have a go at someone for not wearing a mask. I tell you what's got me, especially since I've been here, I don't know whether it's because I've seen more people, obviously, since I've been in London. It's this, so I've been wearing my mask and I hate wearing them, I have to say. I feel very claustrophobic. So I've been walking around like this, doing my bit. I'm passing people who do this. Like hundreds of people wearing a beard mask. I want to go, guys, it's not coming out of your chin. You know, it's like I wear a mask because I'm meant to, but I don't really want to.
But are they doing it just because obviously we're meant to wear it inside shops? So rather than keep taking it on and off and in and out their bag, they just sort of pop it there and then bring it up again when they go into shops. Maybe it's just
because
for convenience.
I've seen people. I went into one of the local supermarkets yesterday, and there was either people without masks or people wearing them like this.
Wear beard
and I kind of wanted to go, come on, pull this up.
Pop it up.
Come on, pop this up.
You know what I think is that the government must come up with some public health advertising, some messaging that is hard-hitting and makes it shameful not to wear a mask. Now, think back to seat belts, for example. I remember when they brought in mandatory seat belts, everyone went, do I have to? And then within a very short space of time, because of the shocking adverts, and they were really, really shocking adverts, we were made to feel that if we didn't wear a seatbelt, we were absolutely doing the wrong thing. And looking back further to the AIDS pandemic, when they had the tombstone ad, which, people said, why are you being so frightening? Because they needed to get a message across that if people didn't alter their behaviour, more lives would be lost from a disease that they still, do not have a cure for. So I think with masks, so far the government advertising, it's been a bit matey, it's been a bit, we're all in this together. But now the time has come, be hard-hitting, saying if you're not wearing a mask, it's shameful. You've just got to change the tone.
And I think going back to what you said there about seatbelts as well, the whole thing about wearing seatbelts is you're protecting yourself.
Yes.
The advert, to me, that was really powerful was don't be the killer in the back. Do you remember when they brought in mandatory seatbelts in the back? The thought that your inaction could possibly harm someone else, I think was really strong. And that's what they need to work on, because the reason that we're told to wear masks is to save everyone else, not necessarily save yourself. We did a poll, actually. We asked, would you confront a face mask flout? And 80% of you said no. No, you wouldn't, which we can really appreciate. Matthew says, I'd like to speak up, and I think I ought to, but I wouldn't have the courage. Plus, and this is something we need to remember, some people are exempt, so not everyone has to wear them for various reasons.